Good evening to my veggie friends, everyone joining me. This is Dr. Natalie Santiago, the vegan pediatrician, and I will be talking about anaphylaxis tonight. Anaphylaxis is a fancy word for severe allergic reaction. So I'm going to give people some time to tune in. My biggest fan just tuned in, my mom. Hi, mommy. So I'll give people just a few minutes to tune in, then I'll get started. But anaphylaxis is basically, like I said, severe allergic reaction. In medicine we like to use fancy Latin or Greek words, usually Latin, but some of our words are from the Greek as well. And so anaphylaxis is one of those, which basically means without protection or without guarding. I'll go ahead and get started. So many things can cause anaphylaxis. Most commonly that we think of anaphylaxis or severe allergic reaction, certain foods. So commonly peanuts, tree nuts. Tree nuts include walnuts, Brazil nuts, cashews, fish including shellfish, milk and eggs. Insects or biologics can cause anaphylaxis. So most commonly we think of bee stings, wasp stings, or fire ants. Certain medications can also cause anaphylaxis. So antibiotics, for example, the penicillins, amoxicillin, ampicillin in the hospital. Morphine, dye that's used for contrast for CT or commonly called CAT scans can cause anaphylaxis. Latex, so there are still some latex gloves around, usually in hospitals or clinics. We don't use latex, but every now and then there is some latex lying around. The reason why we don't use it is because many people do have that allergy to latex. Latex can also be found in adult products. This is a kid-friendly show, so I'm sure the adults know what I mean when I say latex adult products. Bioactive substances can also cause anaphylaxis. So, for example, blood. If someone requires blood, like a transfusion, it's very important that we give the appropriate blood type so that we don't cause anaphylaxis. And then, last but not least, unknown. There are some times that people have anaphylaxis and we don't really know the cause. So who's at risk for anaphylaxis? Because I'm a pediatrician, this topic is going to be geared more toward children, but a lot of this, of course, is applicable for adults as well, because adults do also experience anaphylaxis. But people who are at risk for anaphylaxis, children who are at risk, include children who have had history of previous anaphylaxis episode, or children who have atopic dermatitis, which is a type of allergic eczema. And so the symptoms of anaphylaxis, technical difficulties here. Symptoms of anaphylaxis include changes in your respiratory patterns, so wheezing, labored breathing, and that comes from bronchospasm. So bronchospasm is basically the muscles of the main windpipe or the trachea, or the two windpipes that branch off to go to each lung. Those are bronchi. Those muscles in the windpipes can start to spasm during anaphylaxis, and that can cause wheezing and breathing difficulty. Also commonly hives or urticaria is the fancy medical term for hives, rash or itching. People will experience swelling of the face, the lips, the tongue. Some may also experience tickling sensation of the tongue or tingling. Another symptom, nausea, vomiting, abdominal pain, dizziness, feeling of doom. Imagine if you were having difficulty breathing or you feel your throat closing, you're going to feel this sense of doom. Hi, Dr. Tawana. Thanks for joining me. More serious reactions, although those are serious as well, but also markedly decrease in the blood pressure or shock. And then for young children who either have limited language or no language yet at all, they can be more fretful, more antsy. Young children, they may say their neck hurts if they don't know the word for throat. And they can also mention that their tummies hurt. And so basically what's going on when a person is experiencing anaphylaxis is that there's this complex cascade of reactions in the body that involve immune system cells and substances inside of cells. And your body is basically letting you know that you've come in contact with something that's very dangerous. So in the case of anaphylaxis or severe allergic reaction, if you ever suspect that, it's always best to call 911 immediately. If you're caring for someone who has a known history of anaphylaxis, that person most likely has been prescribed an EpiPen. And so if the person has been prescribed an EpiPen, you want to use the EpiPen exactly as prescribed. The way to do it, and I'm going to post a picture of the EpiPen a little bit later. I don't have one with me, unfortunately. But to administer the EpiPen, there's 2 doses. There's a dose for children who weigh less than 30 kilos, which is about 66 pounds, and for children or adults who weigh more than that. And the way to administer is you want to uncover the thigh. You want no pants, no shorts, because you want to make sure that you're getting this medicine into the thigh muscle as much as you can, or into the thigh. And you don't want any clothing that can impede that. But you uncover the thigh, you inject in the upper outer portion where it's very fleshy. Hi, Dr. Kelly. Thank you for joining me. You want to press down. It looks like a giant ballpoint pen almost, but you want to press down and hold for 10 seconds. If you ever have to use an EpiPen, it's very important. You need to call 911 immediately. If you're with another person who can call 911 while you're administering it, you have to do that. And the reason is the EpiPen, the medicine in the EpiPen, which is epinephrine, it does reverse the allergic reaction. However, that reaction can recur. Usually doctors will prescribe a 2-pack. I know that's what I do. I prescribe a 2-pack, one for home, one for school. That way you use the first. If for whatever reason help can't arrive within that 5 to 15 minutes and that reaction starts to recur, you have a second pen to give that second injection. Okay, so like I said, anytime you need to use an EpiPen, you have to call 911 immediately. And so what will happen is in the emergency room or emergency department, technically doctors call it the emergency department because it's not a room, but you'll hear me refer to in either way, ER or ED. ED for emergency department, ER for emergency room. Things that'll be done while you're there, you'll get another epinephrine dose based on weight. You will get an IV placed for possible IV fluids and medication to be administered through that IV. You'll get an antihistamine. Benadryl is an antihistamine, which is commonly given in the hospital. That's given either by IV or by mouth. Steroid medication is given also by IV or by mouth. Sometimes a child may get IV fluids, depending. Oxygen therapy. Some children, if they're having a lot of wheezing that persists after giving the epinephrine, that child may get a breathing treatment or albuterol through the mask. Also, my sister-in-law just joined me. Hello, Tina. Thank you for joining me. Of course, whenever, a child is in the hospital for anaphylaxis, that child is going to be monitored for several hours. So get ready, parents. You will be there for several hours, and the reason is, like I mentioned earlier, is that there's a possibility for this reaction to recur. And so doctors want to observe the child and make sure that the child is comfortable, eating well, breathing well, and all those things. If a child should experience more severe symptoms such as decreased blood pressure or anything else, that child may have to be admitted to the hospital, to the Pediatric Intensive Care Unit, or PICU. However, if a child does well in the ED, they're observed, they're eating, they're comfortable, the reaction has been successfully reversed, that child will be discharged home, again with a prescription for EpiPen. Doctors do things differently. My personal preference is to prescribe the 2-pack. However, unfortunately, due to insurance restrictions, sometimes parents are not able to pick up that 2-pack. And they are only able to pick up, one for home, one for school. But the EpiPen is prescribed. Again, I'll be posting a picture of what an EpiPen looks like. Children will be prescribed an oral steroid, so prednisolone, which is a syrup or a liquid. I will warn you, parents, it's not very tasty. So you will have a little bit of difficulty given that. Dr. Wilson just joined. Thank you for joining me, Dr. Wilson. Welcome. So the EpiPen, the steroid medication, and your child will also be prescribed Benadryl or diphenhydramine, which is the generic name, which is an antihistamine. And you'll take the steroid and the antihistamine usually for 3 days after going home from the ED. The EpiPen is to be used as needed in the event of that severe allergic reaction with those symptoms that I mentioned earlier. Sometimes because of the steroid medication, usually in a short-term dose like this, you don't have those like GI upset, like stomach cramping. However, some doctors will prescribe a medication to help with that, and again, that'll be taken for 3 days with the steroid. And then we also caution parents that there is that possibility. It's rare, but there is that possibility that the reaction will recur 8 to 12 hours later. And then some people, also a very small percentage, may even have persisting symptoms beyond the 24-hour period. But again, your doctor will go over that with you specifically. Follow-up instructions. For me, myself, anytime one of my patients, and you will hear me refer to my patients as my kids, they're all my kids, I love them dearly. But if one of my kids should be seen in the ED, I want to see that child within 2 to 3 days afterwards, depending. Every doctor's office is different, but I prefer to see children within 2 to 3 days. I do ask that parents bring in any hospital paperwork that you were given that talks about medications that were given, and then any referral information. Sometimes the ED will refer you to an allergist. However, that's dependent on insurance, and so some insurances, they require that your primary doctor, so your pediatrician or your family medicine doctor, gives you that referral for an allergist. Okay, allergists are specialists. They're usually triple boarded, meaning big brains. They've taken 3 board exams in allergy, pulmonology, and immunology. And so those are specialists who are specially trained to handle allergy, whether it be like this anaphylaxis, whether it be seasonal allergies that are very severe, severe eczema, asthma, you name it. They're brilliant. They're the ones to do it. Okay, and so after that follow-up visit and you're given that referral, your doctor, or if you take the child's EpiPen to school, because they will need to have one. Let me just back up. A child will need to have an EpiPen on hand at home and on hand at school. Because we don't want parents to have to, transport back and forth just one pen. Let's say if it's a Friday, you've taken your EpiPen, your child's EpiPen to school, and you should forget it. That whole weekend, your child is vulnerable. So having just one EpiPen going back and forth is just not acceptable. I always want children to have one at home, one at school. If insurance covers it and they're spending time at, both parents' homes, if parents are not together, even a third pen. Because this can be very, very serious. With any school system, if a child needs to take medication during the school day, the school will give parents a form that needs to be completed by the doctor. I always ask parents to fill out your portion, so your child's name, date of birth, and then leave the other part for the doctor, which talks about, the medication, the dose, when it should be given, in what situations it should be given. And of course, those instructions, if it's ever given, someone needs to be calling 911 right away. Because like I said, we want, emergency care so that if that reaction should recur, your child is getting help. And so also I will post a link to the forms that the Chicago Public Schools use. Of course, each school is, dependent. Each school system is independent, rather. But because the majority of my patients come from the Chicago Public Schools, the public schools use that, and I believe that many of the charters use that same form as well. However, you can get the form specifically from your child's school if they're in a different school system. Future cautions regarding children with anaphylaxis. You want to avoid the offending agent at all costs. If you're fortunate enough to know what has caused this anaphylactic reaction in your child, you need to avoid that. So let's just say, for example, if it's peanuts that cause the reaction, you want to make sure that your child avoids all direct and indirect contact with peanuts. So no peanut products in the home. If you go out to eat, you can't have any peanut products, or even peanut oil can make some children react. You don't want any products that are processed in a factory that's handled peanuts, okay? You're really going to have to get really, really good at reading the labels and discussing this with your children if they're old enough to understand that they should refuse anything. If they're not sure, they can't have it. You want to make sure that you don't have indirect contact. So a couple years ago, there was a news article about a teenager who had kissed, I don't know if it was a girl or a boy, but the teenager kissed their significant other. The significant other had eaten a peanut butter sandwich, and that child ended up going into anaphylaxis, and I believe that child died. So even though that child did not eat the peanut butter, having that indirect contact with the peanut butter is what caused the anaphylactic reaction. So you have to be very, very careful. I recommend for parents, if they have a child with history of anaphylaxis, just don't even have that food in the home. Make sure that family, extended family, sleepovers, make sure that they know what the child is allergic to. And then last but not least, this is just a very general overview about anaphylaxis. So if you ever have any questions, please don't use the internet, okay? The internet did not spend 10 plus, 11 plus years in medical school and residency and fellowship and further experience in the field. The internet can only give you a very quick, almost like a log, I don't know how they even do it, and some type of, I don't know, whatever they do. But the internet will have you thinking that you have all kinds of crazy diseases. It will give you very, very broad information. So please, 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 instead of doing internet research, please always talk with your child's pediatrician or family medicine physician. They will have the most up-to-date, evidence-based information for you. Okay. If you have, my cousin Steve just joined me. Hello, Steve. Thank you for joining me. If you have any further questions that are just general, please feel free to respond underneath this live post, or you can inbox me. Again, just please know that I can't answer specific information about your child because I'm not your child's doctor, but I can answer, just broad information and always refer you back to your child's doctor. Oh, and hi there. Somebody else just joined. I can't quite see who it is. I need my glasses. Sorry. But again, thank you so much for joining me. I'm going to post a picture of the EpiPen and a link for the forms for the Chicago Public School System. Again, check with your child's school system for specific forms. Please follow me on social media. I'm the Vegan Pediatrician on Facebook, Instagram, Twitter, Pinterest, Google+. I'm the Vegan Pediatrician on there. So I will come to you next week. I'll be coming to you every Monday for the most part, unless, there's some reason that I can't. I'll be coming to you every Monday at about 7 o'clock Central Time with a new topic. Again, thank you so much for joining me. Thank you for everyone who's tuning in after the broadcast, and I will see you next week, and also on social media on a daily basis. Thank you so much. Have a great day.